All right. Here we go. Admitting people in. Okay, let's go ahead and get started. Hi, guys. Today's class is entitled This Poo Shall Pass. Pretty clever, if I do say so myself. And it is all about diarrhea and constipation. Okay, so welcome to Regenesis RX. For those of you who don't know me, I'm pharmacist Jamie. I've been a PharmD for a while now, over a decade, and I also have my own little health and wellness business that I call Regenesis RX. It's just how I bring you guys these free classes. It also is my app. It's just all of this health and wellness stuff combined that I do. We do have a free class every single month. So if this is your first one, welcome. So happy to have you. Please check out the previous replays. We got several other classes up there already. You should have already gotten an email detailing the class schedule for the next several months. If you signed up for this class, hopefully you received that. If not, please check your spam folder just so you can be up to date on which classes you would like to attend, or make sure to watch the replay. Next month is going to be a super popular topic. It is all about menopause and low testosterone. So many people have been requesting this topic. So hopefully everyone will show up for that one. And I also have a bonus class every month that is for my app subscribers only. That is for people only who are in the Pharmacist Jamie's Tips app. This month, it won't be until March 30th. It's going to be, usually I do them every 2 weeks, but some of the months have 5 weeks. So this month they're a little bit more spread out, but March the 30th will be that class. It's going to be on a Saturday instead of a Sunday in order to avoid Easter. And it is going to be all about heartburn. I try to relate the free class and the paid class to each other. So we're going to be doing constipation, diarrhea, heartburn, stomach issues. Next month, it's going to be testosterone, menopause, and then also prostate and PCOS. So everything next month is all about hormones. All right, stick around until the end and you will get a free gift. I will explain how you can get that. Allow me to introduce myself. As I said, I'm Pharmacist Jamie. I'm on all of the social media. I've been a PharmD now, practicing in retail pharmacy for over a decade. I'm also a health coach and a certified FMACP with my own functional medicine practice. So I like to do a little bit of everything. What can I say? All right. Oh, there we go. What will we cover? I thought my disclaimer was next. See, that's why I need to have my screen right here in front of me so I can see what I'm doing. What will we cover? What exactly is the problem? Why are you experiencing constipation and or diarrhea? Or my favorite, constipation that leads to explosive diarrhea. So much more common than you think. Every time someone tells me that they have this, they're like, it's so crazy, you won't believe it. I'm like, so many people have that. It's not crazy, trust me. It's very common. All right, we will also discuss some Band-Aids that will help get you moving or keep things from moving so quickly. And then we're also going to talk about the ultimate solution, or getting rid of chronic constipation and diarrhea forever. Okay, standard disclaimer, you guys. This is an educational class. Please do not take any of the things I say here as a prescription directly to you. Please bring this information back to your healthcare provider. For the vast majority of you, I am not your healthcare provider. I am with several of you. We're working one-on-one, but for most of you, this is just an educational resource. Okay, so just take it with a grain of salt, do your own research as well, talk to your healthcare provider, get all of the information and make a decision based on your personal situation, your healthcare background, your medications, all of that good stuff. Okay. So as far as some perspective, so many people with digestive issues, particularly constipation or diarrhea, because generally people are dealing with these for years, if not decades, they are so used to dealing with it that they just don't even see it as a problem anymore. They think that pooping once or twice a week or having diarrhea every time that they eat is just how their body functions, especially because digestive issues tend to run in families. You tend to see entire families that are constipated or entire families that are dealing with diarrhea. So they're like, yeah, that's just normal. It's just how it is. People have just accepted this annoying, difficult, uncomfortable, often embarrassing situation as just part of their life that they're powerless to change. So I just want you guys to stop and think for a minute. What are you putting up with on a daily basis? Are you planning ahead for how far you'll be from a bathroom? Are you avoiding things like camping or going out on a boat? That's something I've heard recently. I live in Florida, and someone told me I can never go out on the boat because those bathrooms are not sufficient, and I need to be next to a bathroom at all times. I never know when it's going to happen, right? Do you feel bloated? Do you feel backed up? Do you feel like you're carrying around excess waste? I will say, kind of a little funny side note, my dad had a colonoscopy and he lost 20 pounds with his colonoscopy prep. This is not normal. You should not be carrying around 20 pounds of excess waste, right? Clearly he had something going on. So what have you accepted as normal for you? What has always bothered you and you know it's not quite right, but you just don't know how to fix it, and you've just always been dealing with it? What would life be like if you were just regular and you never had any digestive worries? If you just felt cleared out and not backed up? If you knew you could eat without running to the bathroom? If you just had a nice flat regular tummy? You know, you didn't have this bloating and just constipation that you're constantly dealing with. Just keep that in mind. All right, so what exactly is the problem? Number one is the SAD diet. That's what I like to call it, or the standard American diet. The standard American diet is very low in fiber and nutrients. It is high in sugar and inflammatory substances. And the vast majority of Americans are low in fiber and good fats. And some people are even low in water. So that's a bad combo. If you don't have fiber, water, and fat, you're not going to be going regularly. Another problem is we are often rushed during meals with no time to enter a parasympathetic state. Those of you who are app subscribers, you know we talked about the sympathetic and parasympathetic states in great detail 2 weeks ago. But very briefly, the sympathetic state is activated by pressure, by stress, by needing to be on alert and ready for action. And when we are in this state of mind, which happens a lot of times when we're at work or dealing with stressful situations, whatever, the non-essential things in our body like digestion, healing, and cleaning house internally, all of those things are put on pause. All of the energy goes where it's needed. The parasympathetic state is where we rest and digest. It is best to be able to sit down, relax, take our time eating, savor the food, and to chew thoroughly. People really underestimate how important it is just to chew your food thoroughly in order to facilitate digestion. So many of us are eating on the go in our cars. We've got 10 minutes for lunch. I know that's what it's like at my work. And we're just, you know, wolfing down food as quick as we can. And we are not taking time to enter the parasympathetic state and allow our body to start digesting. Sorry, guys. Sometimes I have trouble with words. If food sits in the stomach too long because we don't get a chance to just sit there and eat and focus on our food, it causes a whole host of problems like heartburn, which we'll be talking about in a few weeks, bloating, and slow motility, or our food just not moving through the digestive tract efficiently. Speaking of slow motility, food should move completely through the digestive tract in about 12 to 24 hours. In so many people, this transit time is off. It could be because we never got to get into the parasympathetic state. It could be because we keep interrupting our migrating motor complex wave, or MMC wave, by snacking. It could be because of medications we are on that greatly slow down transit time, like pain medications, opioids. That is the classic. Anyone taking pain medications, or even if you've taken them short-term after surgery, you know you get constipated. It drastically slows down your digestive tract. Autoimmune disorders like hypothyroid. Hypothyroid equals constipation 9 times out of 10, okay? Not being active enough can also slow down our motility. Sometimes just not getting in the physical activity that we need to have to keep our body functioning properly, that can be a problem. There's also, some people have physical problems of innervation of the large intestine, which causes slow motility. Sometimes that can't really be helped. Sometimes things like that can be helped with surgery. If it can't be helped, you just basically have to deal with it, mitigate it as much as you can, right? Okay, something else is shyness. Now, you might laugh at this, but I have 100% seen this happen so many times where people give themselves chronic constipation because they refuse to go number 2 at work, at school, on vacation, anywhere but their own home. You can actually train your bowel and digestive system to be sluggish, just like you can train it to perk up. We're going to talk about training it to perk up, and the free ebook that I'm giving you guys talks about how to train a sluggish bowel. So you'll get more information on that, but you can also go the other way. Guys, don't be shy, okay? It's natural. It's something that we all do, okay? You don't have to be scared or embarrassed of it. It's, you know, it's a good thing. So don't be shy. Okay. Something else I think is our modern healthcare system. I personally think that it's really good at dealing with pathology. You'll see some people who disagree, but I think in general, our healthcare system is pretty good at dealing with pathology, not good at dealing with like ideal, not good at just, you know, things being a little off, things not being perfect, right? Hold on, let me let these people in here. Okay. Our healthcare system only wants to help you if you qualify under certain numbers and certain rubrics to be pathological. They don't really care if you're well functioning. They just care if you're pathological, right? So that's why I say pathology versus ideal. So technically, constipation is defined as fewer than one bowel movement every 3 days. So if you complain to your doctor that you're only going once every 3 days, in the back of their mind, they're like, that's fine, right? But this is kind of crazy. So those of you who have pets, could you imagine only taking your dog out to poo once every 3rd day? That's it. Of course not. Or for those of you who have cats like me, can you imagine only having to clean poo out of your litter box, one little poo thing every 3 days? No, we would assume that our pet was sick. We would assume that something's wrong, right? So why should we accept that as okay for us because it's not technically pathological yet, right? It's not ideal. Okay, it may not hit the threshold of disease and pathology, but you will not be living your best life if you're only pooing once or twice a week. All right. It's wild to me how often the medical world dismisses diarrhea as well. I recently made a video about digestive enzymes that went insanely viral on TikTok. Those of you who don't see me on TikTok, you should go check out that video. The numbers are just absolutely wild. But the reason it went so viral was because there were hundreds and hundreds of comments from people who have had their gallbladders removed and who were told that their body would adjust naturally, and their body did not adjust. I would say, this is just kind of guessing, but I would say maybe 50% of the people I deal with who have had gallbladders removed, they do adjust just fine. And 50% never adjust, right? But doctors are just saying like, well, my medical textbook said that this isn't a thing and it's not a problem and you're going to be fine. So, and people will come back and say, I'm having explosive diarrhea. What can I do? And they're like, no, you're not. That's not a thing. Like, it's just wild to me. These people even commented that they visited multiple doctors, GI doctors, even specialists, and they were either not given any help whatsoever, and they were just being told, this isn't a thing, you'll be fine. Or they were given crazy treatments like PPIs. I was shocked how many people commented that they received a PPI for chronic diarrhea. How on earth is a stomach acid medication going to help your diarrhea? It makes no sense to me. Yeah. Chronic diarrhea can cause so many health issues like dehydration, electrolyte loss, malabsorption, malnutrition, anemia, stresses to the kidney, kidney stones, kidney disease. It needs to be taken seriously. Chronic diarrhea is not something to dismiss in your patients, right? And that is not something that you should accept in your life either. You shouldn't accept diarrhea or constipation. Okay, another problem is extreme remedies. I see this continuously. I see doctors basically dismissing patients forever, being like, no, it's fine, it's fine. And then just, okay, just take this daily laxative every day for the rest of your life. And I'm like, oh my gosh, why did we jump from like A to Z? There are 26 other letters we can deal with here, or 24 other letters, whatever, right? Why are we going from one extreme to the other of this is fine, it's not a problem, to take a daily laxative? I'm very, very upset by the number of patients who I see being told to take laxatives daily and even prescribed. They'll send over prescriptions for over-the-counter laxatives. And I'm like, I'm not filling this, right? Extended use of laxatives can cause dependence and chronic constipation, not to mention mineral imbalance. In fact, Miralax is one of the least strong medications that I see being prescribed. but it's being prescribed like candy. People are just handing it out every single day as if it's not a problem. When you look right on the bottle, it says it should not be used beyond 7 days, right? Providers have even started calling Miralax vitamin M. I am seeing this on the internet. I even heard a prescriber in real life say vitamin M, and I was like, Miralax is not a vitamin. There are some cases where daily Miralax use is warranted. Absolutely. Okay. I'm not saying that it should never be used daily. There are certain cases, but this is not without consequences and side effects. This is not a vitamin. Okay. It should not just be handed out willy-nilly to everyone. It is being way overprescribed with no thought looking into what is actually causing the constipation and trying to fix that. You're slapping a Band-Aid on it and never even looking into why is this kid, a lot of times I'll see Miralax being given to kids, why is this kid or this adult constipated in the first place? What is going on? And when you look at the data, most of the clinical trials testing Miralax only do it for 14 days. In fact, the longest trial I could find was for 12 months. There may be one longer out there that I just didn't see in PubMed. So let me put that disclaimer, but the longest one I could find was for 12 months. And yet I see people who have been taking it for decades, every single day. Just, I'm sure that's fine. No problem, right? No, we do know that Miralax is very safe for short-term use. If someone needs to use it now and then to go, absolutely. But especially compared to other laxatives, but particularly in kids, we do see reports of neuropsychiatric symptoms, things like tics, anxiety, paranoia, mood swings, anger issues, especially with prolonged use. In fact, there were enough of these reported to the FDA that they did do a 12-month study. That's the one I talked about. Now, I will say in this 12-month study, they did not see an increased incidence of these neuropsychiatric effects compared to a placebo, but it's just the one study. I would like to see more, right? And I think that if you're able to deal with constipation in other ways rather than using laxatives every day, that's certainly the way to go. I was reading a report by a Dr. Ritu Verma, and in the report she says, since Miralax came out, we found it so effective that it is currently the go-to medication to start with, end quote. That same doctor then admitted in the same report that her own patients were claiming that their children were experiencing concerning side effects from Miralax, but then she goes right on in the same quote to say, we do not have any information at all to say this is an unsafe medication, end quote. But the FDA, her own patients are telling her, I think this is going on with my kid. And she's basically telling them, no, everything's fine. That bothers me. I think that we should at least take it seriously. Even if we run all of these trials and we come to the conclusion that, okay, Miralax is not causing any neuropsychiatric symptoms, I think you should at least look into it instead of just telling patients that's not happening. That's what kind of drives me crazy. In fact, the FDA has documented 950 children who reported adverse events to the FDA from 2012 to 2016, ranging from more minor things like mouth ulcers all the way to seizures. Okay, that's 950 people who took the time to make this lengthy report with the FDA and their doctor. So imagine if there are about 1,000 people who did that, how many people had side effects and were like, forget about it, I just won't use Miralax anymore, right? Those are the people who took the time to make the official report, which almost no one does. I can tell you as a pharmacist, it's so incredibly rare that we see someone actually wanting to come in and make a report to the FDA. It almost never happens. My dream is to get everyone off of chronic laxative use. So even Miralax, which as I said, is probably the safest of the laxatives. I would like to see no one taking Miralax or any other laxative daily. All right, so let's talk about the goal, because a lot of times people aren't even sure what exactly is normal. So the goal is, and I hope you guys love my illustrations here. The goal is no rabbit pellets, but no waterfalls either. What we're looking for on the Bristol stool chart is a 3 or a 4. So we want to have some solid substance there. We don't want it to be watery, runny, or just, like number 5 there, where it's just kind of, we want a little form to it, but we certainly don't want it hard at all. 1 and 2, that's too much. So we're looking for 3 and 4. That's the healthy stuff. All right. We also want no strain and no pain. It should not hurt you to go. It should be relatively quickly. So those dads who are spending an hour in on the toilet, we know what you're up to. Okay. After this class, we're going to make it so you can't use that as an excuse. All right. And we want you to be going 1 to 3 times daily. just like your dog or cat. The same schedule that is good for your dog or cat is good for you as well, okay? Okay, so now let's talk about some Band-Aids or quick fixes that can help you to feel better. Very rarely is a digestive issue completely isolated. It does happen, but it's pretty rare. Usually, digestive issues are a symptom of a different problem, okay? So trying to take something to remedy diarrhea or constipation without looking further into what is going on and causing that is like shutting off your carbon monoxide monitor because it's beeping, but not checking to see why it's beeping. Is it beeping because it's low on battery? Okay, no big deal. Or is it beeping because there's carbon monoxide in your house? You know what I mean? We don't want to just shut off the constipation or diarrhea without looking into why it's happening. Just my personal opinion. And digestive issues are usually one of the earliest signs that we get that something is off. Okay. All right. So let's talk about some diarrhea Band-Aids. Number one, this isn't really a Band-Aid, but please, please, please remember to stay hydrated, okay? If you are experiencing any type of diarrhea, whether chronic or short-term, stay hydrated. Your electrolytes can get messed up very quickly. I recently went to the emergency room with dehydration myself, and it even led to low potassium. So it's shocking how quickly your electrolytes can get out of balance and how dangerous dehydration can be. So please, especially kids too, guys, kids get even more dehydrated than we do. Okay. So if you've got a kid with diarrhea, give them those fluids. Okay. All right. The second thing is rule out the dangerous stuff. Okay. C. diff, incredibly, incredibly dangerous, particularly for older individuals. And we will see sometimes people who are trying to treat diarrhea at home and they end up passing away from C. diff, okay, because they had no idea how dangerous it was, all right? And then food poisoning, that's another thing. Guys, do not run and grab Imodium every time you have diarrhea. As an overnight pharmacist, I have someone come into my pharmacy every single week, usually multiple times a week, saying, oh, I think my mom, my dad, my girlfriend, my wife, whoever, I think they have food poisoning. Where's the Imodium? I'm like, do not give them Imodium. Why on earth would you want to keep literal poison inside of your body? Okay. When you get food poisoning, it is usually either a bacteria or a virus that has infected your body. It's releasing all of these endotoxins and lipopolysaccharides. It's making you so sick. Don't keep that in your body. Let it run its course. Okay. Don't treat food poisoning with Imodium. Let it get out, keep hydrated. And then once all of that is out of your body, then you can deal with the aftermath, okay? Let the river flow, all right? Let me just put that out there. Okay, number 3, if you have floating or light colored stools, it probably means that you have poor fat metabolism. Bile salts or ox bile will help you tremendously. That video I talked about that went super, super viral on TikTok was all about digestive enzymes. It was really about this issue. It was about fat absorption. The gallbladder stores bile, and bile is what helps your body to digest and absorb fat. So if you have a gallbladder, the bile is stored inside there, your liver's making it all the time, and then your gallbladder just kind of stores it, waits until you eat a meal that's high in fat, and it releases all of that into your system so that it can be used in order to help break down the fat, absorb the fat, all that good stuff, right? If you do not have a gallbladder, there is no storage system. So that bile is just kind of leaking into your digestive tract continuously. So it's just not nearly as efficient or as effective at helping you in order to digest your fat. So a lot of people who have had their gallbladders removed or who have gallbladder issues like gallstones or blockages or whatnot, they will have problems digesting fat. So taking ox bile or bile salts basically can replace the function of the missing or damaged gallbladder. Now, I in particular talked about Digestzymes. I literally love this product. You guys are probably sick of hearing me talk about it, but it's so cool because it has the ox bile. It also has the enzymes that help you get the most nutrients out of your food. It also has betaine, since so many people are dealing with hypochlorhydria and are not aware of it. If you don't know what hypochlorhydria is, we're going to be talking about it March 30th in the heartburn class. You are going to learn everything there is to know. So I'm not going to get into it here because it's a whole class all by itself. The triple combo of the ox bile, the enzymes, and the betaine is so fabulous. And honestly, it's changing lives. Just check out that video on TikTok if you get the chance. If you're not on TikTok, I'm sorry. The video just didn't go viral on any other social media platform. Not sure why, but the comments on the TikTok video are so interesting and enlightening. So many of the testimonials on my website are also related to this product as well. I do love Digestzymes. It's such a great solution. This is one case where one little pill kind of is a magic cure. So I put it under Band-Aids, but it's not really a Band-Aid. This can be a long-term solution if you're someone who has issues with your gallbladder or have a missing gallbladder and you're having trouble adjusting and you need help with fat absorption. This is the solution, okay? LVGB, that's another great supplement that basically it's pretty much the same as Digestzymes, except it doesn't have the betaine. So it's for people who don't have hypochlorhydria, which plenty of people don't have hypochlorhydria as well. It's just another good option. You could also just do ox bile or bile salts alone. I just find that it's so beneficial to combine them with the digestive enzymes as well. Okay, solution number 4. There is a probiotic that really helps with diarrhea. It is called, I'm probably going to butcher this, Saccharomyces boulardii. It's in the Designs for Health product Floromyces. That's why I have it listed there as Floromyces. They're the same thing. You can also get it from other companies as well. But this is such an interesting probiotic. One systematic review of 27 different clinical trials involving over 5,000 patients, so this is a pretty big review, showed that 84% of the treatment groups that received this probiotic for multiple different causes of diarrhea, so it's not just due to one thing, it's like people coming at this issue from all different types of diarrhea for all different kinds of reasons, they were able to be cured or relieved of their diarrhea. 84%. That is massive. If we find a medication that has an 84% cure rate, you know, we're all over it. So that's really cool. And it's also nice because it's super safe. It's just a probiotic. You know what I mean? So it's safe to use daily if required. It's not something where it's going to cause your digestive tract to become super dependent on it. Super interesting. So this is one of my favorite things for people with chronic diarrhea is to get some of that Saccharomyces boulardii in them. And a lot of times if we check like a GI map, they don't have any Saccharomyces boulardii. That's one of the reasons why they're having chronic diarrhea, because they are missing this keystone species that helps keep their digestive tract functioning well. A couple other options. So bentonite clay is something that can be helpful. 1 teaspoon daily is okay. And also chamomile. I personally really like chamomile as a tea. I think it's also great because it can help with sleep, but you will see chamomile thrown into some digestive supplements and it's really beneficial there as well. It's kind of nice to just add it in with several other things. It's good stuff. It has shown some efficacy in clinical trials. Okay. All right, so let's talk about constipation Band-Aids. Okay, number 1, once again, not really a Band-Aid, but just getting the appropriate amounts of water, fiber, and fat can often help to solve constipation, especially for someone who is on the standard American diet, who is not getting nearly enough fiber. For women, we want at least 25 grams of fiber. For men, you want at least 35 grams of fiber every day. We want nice, good fats like avocado and olive oil to help grease the pipes. We do not want to increase saturated fat. We never want to increase saturated fat if at all possible, but those nice unsaturated fats, wonderful, especially omega-3. Number 2, this is an option that you can consider is MCT oil. That's medium chain triglycerides. This is often derived from coconut oil. Once again, it helps grease the pipes. You know, if you got like a pig stuck that's trying to come out, sorry guys, I grew up on a farm. So I talk about, you know, horses and farm animals too much, but if a pig is trapped, what are you going to do? You're going to grease it up and push it out, right? You're not just going to try and shove it out without any grease. So sometimes you just got to grease those pipes. And 1 teaspoon daily of the MCT oil can be very beneficial for a lot of people. You'll see a lot of people putting this in their coffee, which coffee can also help to stimulate the bowels. So that's kind of a 1-2 punch there. If you got a teaspoon of the MCT oil in your coffee, that should help, right? Okay, so the next one is the constipation trinity. A lot of you guys have heard me talk about this, and I've been kind of talking to you one-on-one, many of you about this, but this is my favorite. I absolutely love this trinity. I would say it helps at least 9 out of every 10 people who I suggest it to. It's so great. It's basically 2 magnesium glycinates, 1 tributyrene, every single night, and then ColinRx as needed. So the magnesium glycinate complex from Designs for Health is what I typically recommend. It is so good at preventing constipation. It is mostly magnesium glycinate. It just has a touch of mag citrate. So it's really good for long-term use. It's okay to use daily long-term. I'm not a huge fan of using magnesium citrate alone every single day. It tends to be too stimulating, and then you're missing all of the benefits of the magnesium. The way that magnesium citrate works is it just stays in your digestive tract and you don't really absorb it. So it's really stimulating to the bowels, but you're not getting any of the benefits of the magnesium for the rest of your body. And we know that magnesium gets super depleted through medications, through all different things that we have going on in this modern life. So most of us need magnesium. So it's nice that they put it in the glycinate complex. You know what I mean? So it gives you just a little bit of a touch with help with constipation, but you're also still absorbing plenty of awesome magnesium for all the other things that we want it for, like blood pressure regulation, anxiety, restless leg syndrome, restful sleep, all of that. Okay, and then also the tributyrene. That is the second part of the constipation trinity. It helps to grease the pipes, you guys. It's a potent anti-inflammatory that can also help with intestinal barrier repair. And it's made from like the medium chain fatty acids. So it's kind of like the MCT oil. You know, if you're not someone who likes to necessarily take the oil and put it in your coffee, this is a great alternative. Comes in a super tiny little easy to swallow pill. Absolutely love this product. Now, ColinRx, this is the one that you take as needed. It has triphala. This is a wonderful motility agent. So it is going to stimulate your gut to move more quickly and get things through your digestive tract in a quick manner. I don't like to use the ColinRx or the triphala every single day if possible. I like to tell people to take it every night for about a week alongside the other two. I suggest taking the other two about an hour before bed for most people. And I'm like, okay, take this every night for a week or maybe two to get started, get you in a nice regular pattern. Your body's used to this pattern. Everything's going great. And then kind of back off of the ColinRx. Then continue to take the other two every single night. They're perfectly safe to take every night. And just take the ColinRx at night if you have not had a bowel movement all day. Okay, so then that should stimulate you to go right away the next day or maybe even that night, but usually it's more like an overnight product. So that is how I like to use that, just kind of as needed here and there, which is nice because one little bottle of ColinRx can last you a really long time. Okay, another option is low dose naltrexone. For those of you who were there in my Facebook Live today, you heard me talking about this product. I love low dose naltrexone for literally all of the things. It is a potent anti-inflammatory. It's also super beneficial for Hashimoto's hypothyroid patients, super beneficial for pain patients, fibromyalgia patients. It's also a motility agent. But when you use this low dose, which is usually given at like 1.5 to 4.5 milligrams instead of like the 30 that we normally see dosed for like opioid dependence, it's a very weak motility agent. So it just kind of gives you a boost in the right way, but your body's not going to become completely dependent on it, unlike the really stimulating agents that we see. And low-dose naltrexone, it's so interesting. The way that it works is it partially binds to your opioid receptors, so it kind of blocks those. So most people will take it at night before they go to bed. So their opioid receptors are blocked at night. Who cares? No one notices you're asleep. And while those receptors are blocked, your body senses that. So it starts cranking out more and more dopamine because it's like, whoa, our opioid receptors, they're not getting the dopamine. What's going on? Let's make more dopamine. It lasts for about 8 hours. In the morning, when you wake up, that low-dose naltrexone is starting to get off of those receptors. And now you have tons of dopamine that your own body created jumping onto those receptors. It makes you feel amazing. It brings down inflammation. It's a feel-good hormone. You know, dopamine, the feel-good hormone. It makes you feel great. It helps to get rid of your pain. It helps with arthritis. It helps with so many things. And the great thing about it is your body's own dopamine. You can't overdose on it. You can't get too much of it. Your body is only going to make so much before it stops, right? So it's kind of nice. It's like self-regulating. So I love low-dose naltrexone to boost your own dopamine production and to just help your own body kick in and get things on track rather than adding in things exogenously. This is just like a temporary blocker to convince your body to make more of your own natural hormone. Great. Okay, so now I'm going to talk about all of the OTC medication options here because these are fine, for occasional use. Okay, it's very normal to get backed up from time to time due to something going on in your body, your environment, something you ate, whatever. I do know tons of people complain to this about me as a pharmacist. Like, every time I go on vacation, I can't poop. I don't know why. I don't know if it's shyness or if it's the food, whatever. I just can't poop. So now I haven't gone all week because I was on vacation. Please help me, right? That's pretty normal. So it's fine to use these OTC options occasionally. What is not normal and generally not good is to be using these every single day or even weekly. Like, if you're reaching for a laxative 3 times a week, that's not normal. You know what I mean? So it's fine to keep these on hand and use them as needed. So that's why I'm going to discuss, how they work, the benefits of each one, how long it takes, whatever. But please do not use these daily if you can help it. Or at least talk with your doctor about the benefits, the risks, all of these things. And, let your doctor look into why you have chronic constipation instead of just slapping a Band-Aid on it. Okay. So the first thing is going to be Docusate because it's the weakest. This is actually a stool softener that doesn't really help you go at all. It just makes it easier to go by making the stool softer. So most doctors will suggest that this is okay for daily use. I'm on board with that as well. If you're doing something like taking an opioid, for example, you're probably going to need a stool softener because it's going to greatly slow down that motility time. It's going to draw all of the water out of your stool, make it super hard and difficult to pass. So if you've got something like that going on, sure, a stool softener is okay for daily use. We don't really see issues long-term with stool softeners that I'm aware of for sure. The next thing I'm going to talk about is Miralax, or also milk of magnesia. These are oral osmotics. So the way that they work is by drawing water into the stool, making the stool easier to pass. And they also increase colonic peristalsis. So they're going to basically make your colon push things along quicker. These generally tend to work, sorry guys, in about 1 to 3 days for most people, if they are going to work. They don't always work for everyone because they're on the weaker side of the spectrum here, but generally in about 1 to 3 days, you should see some movement. Senna and bisacodyl are the next category here. And these come in oral and rectal varieties. So that can be beneficial. Like if you've got a kid, for example, you can get like the bisacodyl or the glycerin suppositories, especially if they're too young to take anything orally. But these will basically they will trigger rhythmic contractions of intestinal muscles. So it's just going to kind of work on the entire intestine. Oh, hold on. My computer's getting ready to die. Okay, there we go. So the problem with taking these every single day is your body can become very dependent on them. Your body will basically stop doing the peristalsis on its own. It's starting to depend on this. And if it doesn't get it, you're going to get super, super, super backed up. This is not ideal, obviously. But these types of things can work between 8 and 24 hours. We generally call this like overnight relief. A lot of times you'll see that's the way that it's labeled in the pharmacy because it takes between 8 and 24 hours to work. Okay, the next thing is the liquid magnesium citrate. Now the magnesium citrate pill can be stimulating enough, but it's generally not insane. The liquid magnesium citrate, those of you who have gotten a colonoscopy, you may have been suggested this or prescribed this. It will absolutely clear you out. You'll get the little bottle, and for a colonoscopy, generally we'll say take the entire bottle. For someone with constipation, we'll say maybe take a third to half of the bottle. This is very intense. If you do not get cleared out with magnesium citrate liquid, see a doctor. Go to the emergency room, call your doctor. If this does not work, you probably have an impaction. And a lot of times the only way to get rid of an impaction is to have it physically removed. Okay, an impaction can be a dangerous situation. So if you get all the way down to this level and you're still not moving, you need to see someone, okay? Now, the liquid magnesium citrate should work within 30 minutes to 4 hours. Okay, so we're getting quicker. I'm kind of going down the line and how intense they are. And then the last thing we'll talk about is an enema. You'll see them come in the like mineral oil and then also the saline form. I will say most doctors suggest the saline form for whatever reason. It's also what we sell 9 times out of 10, but the mineral oil is an option for those who'd rather do that. It works in like 10 to 15 minutes. It works super quickly. And once again, with an enema, if it does not work, see a doctor. You probably have an impaction. If you are using something that intense and you're still not getting anywhere, you need help, okay? And then I also just wanted to bring up hemorrhoids because a lot of times constipation and hemorrhoids go hand in hand with the straining, with the physical difficulty. When it comes to hemorrhoids, I love Mother Love Topical Roid Balm. You can get it right on Amazon. It's super cheap. It is so much better and safer to use long-term than Preparation H. It's very soothing, very healing, great, great stuff. I recommend that every time someone asks me for hemorrhoid help. And then if you have reoccurring hemorrhoids, you can look into a supplement like Vessel Forte from Designs for Health. That's my favorite. Or also Collinsonia Root. That's from Standard Process, a different company that's also third-party tested. Those can really help with blood vessel support. I really like those supplements. Just kind of helps. I mean, you can use it for any other type of blood vessel support as well, but it can help strengthen the blood vessels and make you less prone to hemorrhoids. Starting to lose my voice again, guys. Sorry. Maybe I shouldn't have done the Facebook Live right before this. Okay, so now let's talk about the ultimate solution, which is finding out the root cause of the problem. Why do you have constipation or diarrhea in the first place? Okay, so why might you have diarrhea? Could be issues with fat absorption, like we talked about. These are most often related to the gallbladder. Okay, if you are having light colored stools, if you are having floating stools, talk to your doctor. That's not normal. It should sink. Okay, and the stool should not be light colored. They should be brown. Okay, so if you've got that going on, talk to your doctor. You probably have a problem with your gallbladder. Okay, another thing could be dysbiosis or SIBO, which is small intestinal bowel overgrowth. We're going to do a class all about SIBO, all about bloating, all that good stuff. So we'll talk about that much more. But this is basically an imbalance in the gut microbiome. A lack of Saccharomyces boulardii, for example, that's absolutely going to cause you to have diarrhea. Sometimes it can even be a parasite in the gut. Now, sometimes we always look for horses. We don't look for zebras. So, a lot of times we will neglect parasites because it's pretty rare that someone has a parasite. It's much more common that they have some other issue or even a virus or bacteria, whatever. But I can tell you, I personally have done GI maps, especially with people who have been treated with every other various thing and it doesn't seem to help. Turns out they have a parasite. That was the whole problem. So often people who have bacteria, virus, parasite, whatever, they will present with diarrhea. So that is possible. Hormone issues. Hormone issues can absolutely cause diarrhea. Hyperthyroid will often cause diarrhea. So hyper usually causes diarrhea. Hypo usually causes constipation. For women, prostaglandin action around the time of menses will often cause diarrhea as well. A lot of women ask me, why do I get diarrhea this time of my cycle? That's why. It's because of the prostaglandin action. It's very normal. It's just a hormone that basically causes that. Unfortunately, it's not pleasant. As hormones fluctuate during menopause, we often see GI symptoms arise as well. Could be constipation or diarrhea, honestly. It just kind of depends on if you're getting too much or too little of your progesterone, for example. And men, you do not get out of this scot-free, okay? Because low testosterone can cause diarrhea. So men, if you're finding as you age that you're getting more and more diarrhea, it could be directly related to the low testosterone. Sorry, guys, my family's making a whole bunch of noise back there. Don't worry, I'll scold them after this. Okay, now something else that can cause diarrhea are Crohn's and other GI illnesses. Now, unfortunately, sometimes we don't even know why someone has Crohn's or a certain GI illness. Oftentimes there will be a genetic component, but sometimes we just don't know why. And sometimes these cases are not necessarily treatable, but they are manageable. Okay, so we can try to manage them with these other ways that we talked about rather than just Imodium all day, every day, right? Now, medication. Oh, hold on, I skipped one. Food allergy or intolerance. So if you eat a food, if you eat a food that your body does not react well to, it can often cause diarrhea, especially if you have an intolerance. Now, a lot of times we will see this, like I was talking about earlier with celiac disease, a lot of times it will cause diarrhea. Sometimes it causes constipation, and sometimes you have absolutely no GI symptoms whatsoever, like myself. So just because you don't have GI symptoms, don't necessarily rule out celiac. Get your testing done. But usually if you have an insensitivity, an intolerance, an allergy, anything of that nature, your digestive tract will react in some way. Okay, another thing that we will see are medication side effects. So many medications cause diarrhea. I think the number one has to be antibiotics. I warn almost everyone who takes antibiotics, you will probably experience nausea and or diarrhea. You can take a probiotic that may help, but sometimes the probiotic doesn't help. It's just kind of part of it. Most antibiotics are short-term at least, so then you can get back on track once you finish the antibiotic. Antidepressants can also cause diarrhea. They can cause constipation and diarrhea. It just kind of depends on which one and how you react. Antacids are another thing that a lot of people are totally unaware of. If you're popping antacids like candy and have diarrhea, the two are often related. PPIs can cause diarrhea. Any of these medications that affect your digestive tract can affect your downstream digestive tract as well. Chemotherapy. Unfortunately, a big side effect of chemotherapy is diarrhea. Just try and stay hydrated. Try to take the emetic medications in order to help prevent the nausea. Do the best that you can. Obviously, chemotherapy is really important to stay compliant and to stay on track taking that. NSAIDs, this is going to be your non-steroidal anti-inflammatory medications, your things that can help with pain and inflammation like ibuprofen, like Aleve, anything like that can also lead to diarrhea. And metformin. Metformin, I get so many complaints about metformin. I will say that if you ask your doctor for the extended release version and take your metformin with food, it will greatly decrease your risk of diarrhea or of any stomach side effects with metformin. So please, 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 I try to get everyone switched onto the XR version and I try to convince them to take it with food. It's going to make a really big difference. And then also infection. As I said earlier, viral, bacterial, parasite infections, many of those lead to diarrhea. Okay, so how about constipation? Why would you have constipation? Number one, insufficient water, fiber, fat, as we discussed many times. Okay, number two, poor eating habits that we discussed back in the beginning. Remember how important activating the parasympathetic nervous is. It's literally called the rest and digest system in like all of the literature, okay? Also, a potty stool can really help. The position that we have our toilets in here in the US, it's probably the worst possible physical position to try and have a bowel movement physically. It just does not line our bowel up correctly. We're like literally fighting against gravity here. So you don't have to get like one of these fancy potty stools. You can just get any stool. Put your feet up on it. That is going to put you in a much better position physically. And a lot of times you'll even see like rocking. That can help, okay? If you feel the need to move side to side while having a bowel movement, roll with it, okay? Also, people have different little physical things in their large intestine. So sometimes, you know, moving this way or that way is just intuitively you helping get around whatever physical issue you have in your colon. And also snacking all the time, you guys, that's part of poor eating habits. Try not to snack if possible. Now, if you have some type of condition or hypoglycemia or something, fine, you're gonna have to snack. But for those who don't have those issues, spacing out your meals about 4 hours, allowing that migrating motor complex wave to finish is going to really help because it's going to keep your digestive system pushing your food through. Your digestive system stops every time that you put food in your mouth. It just stops and waits for the food to get down into your stomach. And then it's going to take it an hour to restart again. So, you know, you're just constantly putting off this peristalsis wave. All right. Once again, hormones. Hypothyroid. I cannot emphasize it enough. Hypothyroid equals constipation 9 times out of 10. This is one of the first signs many women get that they have hypothyroid issues. It's constipation, okay? Also cortisol, all right? We talked all about this a couple weeks ago. For those of you in the app, when your body is freaked out, it shuts down digestion. It prioritizes cortisol production over everything else. It just literally stops your digestive tract. Your food just sits there. This is not good. We don't want your food sitting there rotting. We want it to keep moving, right? Neuronal influence. This is a big deal when it comes to constipation. We will see people who have experienced traumatic brain injury often struggling with constipation. Also, low vagal tone. If you don't have good vagal tone, if your parasympathetic system cannot get activated very quickly and efficiently, that can be problematic. And once again, an interrupted MMC wave that falls under neuronal influence. Structural issues. Sometimes your body's just built a little bit different. We'll see something like a hairpin turn or a physical problem that could only be addressed with surgery. So sometimes people need to have surgery in order to fix something like a hairpin turn, or sometimes surgery is not really an option. And then you just have to manage it as best as you can, right? But at least you know what's going on. You know this is going to be a problem, and you're doing the best that you can to fix it rather than just slapping a Band-Aid on it and hoping that it's not something more serious. Once again, underlying disease like celiac or Crohn's disease, okay? It could go either way. You can get constipation or diarrhea, kind of depends. And dysbiosis or SIBO, that is an issue with constipation as well. It can cause constipation or diarrhea depending on what is overgrown. For example, with constipation, a lot of times we will see an overgrowth of Methanobrevibacter smithii. If I see a huge overgrowth of that, my first question is, are you constipated? And every time they're like, yes, yes, I am. Medication side effects. Opioids, you guys. Opioids are absolutely huge here. Also antidepressants. Also, certain high blood pressure medications can cause constipation, and antihistamines. Antihistamines really dry you out. This is why we try to avoid antihistamines in older individuals. They seem to be much more sensitive to this side effect. They can get really dried out, really dehydrated, really constipated just from something like Tylenol PM or Benadryl. All right, so try to avoid chronic use of antihistamines. It's really going to mess up your digestion. Okay, so I wanted to talk about a pretty cool example. This was actually a real patient that presented to my mentor that always stuck with me from class. So I'm just borrowing examples. Wasn't my personal patient, but I'm borrowing an example of a real patient from my mentor who I absolutely adore. Anyway, she brought it to one of our lectures and I just thought it was so interesting. So the patient presented with constipation, okay? So did some testing, discovered, oh, she has hypothyroid. As I said, very, very, very common, all right? So rather than just stop there and give the patient thyroid medication, which they did need thyroid medication, but it's beneficial to keep going and seeing why do they have thyroid? Is their thyroid gland just dysfunctioning for some reason? Is it Hashimoto's? Is it autoimmune? So we did further testing, discovered that it was autoimmune. Okay, so why is she having this autoimmune reaction? We want to address the autoimmune issue because her immune system is not going to just stop at thyroid. It's going to start attacking other areas of the body, right? So we want to figure out, why are you having this reaction? How can we dial it back? So we ended, well, not we, but my mentor, we in the royal sense, she ended up doing a GI map test with this patient and discovered an overgrowth of Klebsiella pneumoniae, causing an excess LPS. That is lipopolysaccharide. It's basically an endotoxin that's released by bacteria. And they found this in the blood, and it was triggering an autoimmune Hashimoto state, leading to hypothyroid. Okay, so obviously you're going to treat the Klebsiella pneumoniae at that point, right? But then the question is, why does this patient have Klebsiella pneumoniae overgrowth, right? Because generally our gut should balance itself out. This is a complicated ecosystem that should basically run on its own. If something gets out of whack, we need to know why. So my mentor continued doing further testing. This is why I said this is like one of my favorite cases that always has stuck with me. So she did more testing and discovered that the original overgrowth was due to hypochlorhydria. This patient, for whatever reason, I don't think that they had H. pylori or anything, but they just had hypochlorhydria, which is too low of stomach acid. So my mentor resolved this issue with the betaine. She also did a kill protocol to get rid of the Klebsiella overgrowth. And then the patient also required thyroid medication at that point because the thyroid was too far damaged. So she needed a little bit of that. So the entire thing was completely fixed with those three things. The thyroid medication ended up being a lifetime thing. And then the betaine as well, just because the patient had idiopathic hypochlorhydria. But the Klebsiella was treated and then it was gone. Everything was resolved within like 2 weeks. So that is how I want you guys to start thinking. I want you to start thinking globally, okay? I want you to start taking things back to the beginning. So often people come to me as a pharmacist looking for the best pill to solve XYZ symptom, which is completely understandable. But what can be the most beneficial is start thinking, but why? I have a migraine, but why? I can give you a pill for a migraine, but why do you have the migraine, right? Same thing with hypochlorhydria, same thing with hypothyroid, same thing with basically any condition. I want you to start thinking, why did this happen in the first place? What can I do to bring it back to the original problem, rather than just looking for a pill for every symptom? Okay, so you guys, there is a free gift. If you go to www.regenesisrx.com, click under the education tab, you will get my free ebook all about constipation and diarrhea. Those of you in the app, it should already be uploaded there. I'll double check right after this to make sure I'm not a liar. And I will put up this replay later on in the app and also on the education tab for anyone who missed it, or if you want to share it with friends, family, whatever. And now, oh yes, please, guys, download my app. It's awesome. I think my app is great. And it's only $6. I tried to make it literally as cheap as humanly possible. We've got these webinars in there. You get 2 webinars every month. You get ebooks every week or so, probably even less than that. You get new recipes every single month. You get all the goodies. I really do love my app. And we have a live Q&A scheduled every single Monday morning, 9:30 a.m. in the app. And I'm also accepting patients at regenesisrx.com. So if you guys want to join my practice, if you want to order your own tests and work with me further, wonderful. And I am going to, oh, someone raised their hand. That's so cool. I didn't even know you can do that. Hold on. Let me stop screen sharing so that I can see, the chat. Where's the chat? There's the chat. Okay, great. Okay, so there, I asked you to unmute. So I don't know if you want to ask me a question, Zoom user, but you should be able to. I don't know how I unmute. I don't know. I'm trying to unmute you, but I will go ahead. I see you raise your hand. I just don't know how to answer it. I'm sorry, guys. I'm so bad at Zoom. Let me apologize. I'm terrible. All right, let me look in this chat here and see whatever questions. Oh, thank you so much, Kathy. I appreciate you. I take generic Nexium every day per my doctor's orders. Is this causing diarrhea? And how can I wean myself off? I know it can't be my solution for severe heartburn. Okay, Janice. Yes, Nexium can absolutely cause diarrhea. How can you wean yourself off? Well, talk with your doctor for sure, because you never want to quit a medication without your doctor's blessing. But if you want to wean off, one of the best ways to do it is basically to start going like once every other day and then once every third day, and keep the Tums, the antacids on hand for when you have like a flare up, because it will happen as you're slowly getting off of this. But yeah, I know a lot of people don't necessarily need a daily PPI. If you're an app subscriber, please, please, please come to the March 30th class all about heartburn. We're going to talk about this in so much more detail. But the biggest key is talk to your doctor, get their blessing, make sure they're okay with it. A lot more doctors are accepting of people wanting to get off of PPIs now that we have this long-term research showing that they're associated with osteoporosis, with nutrient depletion, with all of these things. So a lot more doctors are open-minded about getting people off of PPIs. So they can really help you to do that. But basically, slow and steady. After open heart surgery, my daughter had extreme constipation. Yes, hospital tried everything, but it was real high up. What to do when this happens at home? Okay, Penny. So that can be really difficult. Now, after surgery, we can see really, really, really bad constipation for a few reasons. Surgery itself kind of stuns the gut. It like just stops the gut from moving. Okay. So that's one thing that happens with surgery itself. Also, pain medications. If you're going to be having open heart surgery, I'm assuming that you're taking some decent pain medications. They are literally like rearranged your whole chest, right? So the pain medications are also extremely constipating. And I will say that almost everyone who goes through surgery has to deal with constipation on some level. If it is that bad, I don't know if you're going to be able to manage it at home. The enema and the magnesium citrate are the strongest things that are available, but those might not even be enough. If you use those things and they don't work, you need to see a doctor, because as I said, impaction is very serious and very dangerous. Okay, so if it gets that bad and you can't get helped, sometimes you just got to see a doctor. Okay, what can I do all the other hours to help? It's affecting the quality of life. Yeah, no kidding. Okay, so Minnie, you are dealing with a lot of the things that we were talking about as far as all of that fun stuff. Bile acid diarrhea can be so terrible. Now have you, oh, here we go. This is a direct message. Okay. I would not take Imodium every day if at all possible. I would ask your doctor about bile salts, because that can really help. And I see a lot of people who are taking both of those medications with the bile salts and don't have a problem. I completely understand what you're talking about. Yeah, it absolutely affects your quality of life terribly. Ask your doctor if they would be okay with you adding in some bile salts and ox bile anytime that you eat when you're not directly taking the other medication, okay? How do you make sure you don't get C. diff? Well, Marcia, it can be, you can't necessarily guarantee that you won't get C. diff. C. diff oftentimes pops up after we finish doses of really strong antibiotics, especially like full spectrum antibiotics. So if you can avoid those, that's one good way to help avoid C. diff. Other than that, boy, it's hard. The thing about C. diff as well is it doesn't get killed by alcohol. So hand sanitizer is not usually helpful. You have to actually physically wash your hands with soap and water. So that can make dealing with C. diff really challenging, because, you know, walking in and out of the doctors, the different hospital rooms and whatnot, they have those sanitizers, which are not going to really affect C. diff. So that's really important. Proper hand washing for at least a minute with soap and water. Trying to avoid broad spectrum antibiotics as much as possible. I mean, those would be my biggest tips, honestly. Unfortunately, there's no way to guarantee you won't get it. I know I live in mortal fear of C. diff myself, because I've seen people dealing with it, and whew, I was on LDN years ago and did not realize it actually helps with constipation. Yes, it does. It helps with constipation, helps with everything. I love low dose naltrexone. Okay, can you name the actual brands in drugstores that sell them to alleviate diarrhea? Okay, so the probiotic, okay, so for Designs for Health, that is the brand that I use most often. I absolutely love that brand. It's all third-party tested. Designs for Health has the Floromyces, that's the probiotic. They have the Digestzymes and the LVGB. Now, with you particularly dealing with the issues you're dealing with, I would go for LVGB because it has more of the bile salts than the Digestzymes. So I would just go with the heavier one, the LVGB, okay? Now, as far as the bentonite clay, that one, gosh, I don't even really know who carries that. I personally have never recommended bentonite clay. It just keeps coming up in the literature. So I went ahead and included it, but it's not something that I've personally worked with. I just wanted to include it for completeness' sake. Would drinking lots of water dilute the bile that irritates the colon because no gallbladder to store the bile? Would any food help coat the colon and decrease the bile irritating the colon? Yogurt, can't eat it 24/7, but anything that might help. Gosh, I don't know about water diluting the bile. That's a good question. I would talk with your GI doc about that. I'm honestly not sure if there's anything necessarily that would make it all the way to the colon to coat it. You know, most of our food is going to get broken down far ahead of that, like yogurt, for example. Maybe the yogurt's just helping you because it has some of that Floromyces probiotic in it more so than coating the colon, because it's just not going to make it down there. Does rheumatoid arthritis medications irritate the colon to cause diarrhea? Take the food, but still wonder. I had my gallbladder out 15 years ago, but only the last 4 years I'm having chronic diarrhea and urgency issues. I do see a GI doc and get routine colonoscopies. Okay, great. Yeah, I mean, rheumatoid arthritis medications, they certainly can, especially the sulfasalazine, more so than the hydroxychloroquine. So that could definitely be a part of the picture. I have to think that it's more the gallbladder and that it's just getting worse as time goes on, but it's certainly possible. I have a very complicated GI system with IBS, C and D. Ooh, gastroparesis due from, oh my goodness. I just saw my GI doc on Friday for a follow-up. She now wants me to take Metamucil, 3.4 grams, 7 grams powder in the morning and liquid, and magnesium oxide 500 milligrams, which I'm already taking one. She also wants me to take Miralax. Okay. She also wants me to follow a low particle diet for gastroparesis. I have hypothyroid and Hashimoto's, RA, and quite a few other medical conditions such as scoliosis, spinal stenosis, DDD, and many other spinal conditions. My question is, do you agree with my GI doctors? Your case is so complicated for me to try and comment on. I think certainly the psyllium husk is a great idea. The psyllium husk is probably the most beneficial fiber that we see out of any other ones for helping with constipation in particular. If she wants you to do these things and you've got all this going on, I would go with her suggestion and see how it works for you. Give it a couple weeks. Thank you, Ray. And see what happens. It's too complicated for me to comment on here. I just don't know enough. I would need to have like all of your labs in front of me. And you know what I mean? It's just too detailed and specific of a question for me to get into here. Sorry. Thank you, Ray. Awesome. Bye. So good to see you. Love, Ray. Does Ozempic slow down? Yes, Ozempic, absolutely. Any of the GLP-1 agonist medications will absolutely slow down the GI tract. Now, I will say that we tend to see this issue more so when you very first start the medication, and then also when you increase your dose. So when you first start, you'll have that for a couple of weeks where your GI tract is really slowed down. And then if you up your dose, then you'll experience it again for a couple of weeks. Most people who take the medication long-term, that side effect tends to dissipate with time. So, but yeah, it slows down the GI tract. If you are overweight and have chronic diarrhea, do you think this would help? Minnie, I don't think it would necessarily help your situation because you're dealing with the bile acid diarrhea more so than just quick motility. You know what I mean? So no, I don't think it would help. I mean, maybe it's possible, but it's two different problems. You know what I'm saying? What is the website for the free gift again? It is regenesisrx.com under the education tab. Sorry, guys. I know that's like kind of a clever name that's a little hard to spell. Let me try to type it in here. Okay. There you go. Hopefully that works. Okay, let's see. Can you address the Facebook ads that talk about probiotics that cure stuck poop? What? I have not seen this. Okay, Susan, I am intrigued. Can you please like screenshot this and send me an example? I have to see this now. Boy, stuck poop. Okay, guys, to me, stuck poop sounds like impaction, which should only be handled by a doctor in a hospital setting, or at least in like a clinic or something. Not something that I would try to handle at home. I don't know what they're referring to as far as stuck poop. That's what I think of. When I think of stuck poop, I think of impaction. If they're just talking about extreme constipation, boy, I'm curious which probiotic they're talking about. Boy, I need to see this ad. Susan, please send me this ad. We're going to be in communication because I am intrigued. Thank you so much, Carolyn. I appreciate you. I'm such a complicated patient. Sorry. Oh, that's okay, Deborah. I'm sorry. Yes. Oh, thank you. I appreciate you so much. And good luck. Hopefully, this regimen that your GI doc has given you will be really beneficial. I will say they're throwing the kitchen sink at you. You know what I mean? And sometimes that's what people need. So good luck to you. Does collagen cause constipation? Judy, it should not. Now, I will say that if you're eating a super high protein diet with very little fiber, so like a lot of people eating like the carnivore diet, for example, they can experience constipation for sure. And collagen is fairly high in protein. I think a scoop of mine is like 9 grams of protein. It's not too high, but it shouldn't, especially if you're getting in plenty of fiber. So make sure you're getting your fiber. If you want to take your collagen alongside some veggies to make sure you're doing that, could absolutely do that. What can be used to treat gastroparesis that is safe for chronic kidney disease? Ooh, Robin, I'm sorry. That is out of my wheelhouse. I don't want to talk out of turn. I don't feel that I know enough on that topic to discuss it here. I'm sorry. Where can we find a link to your app? Oh, Charlie, please join. So you can find it. Just go to the App Store. It's on Apple and Google Play, so whichever one you use, and type in Pharmacist Jamie's Tips, and you should see it there. And welcome. The cool thing about the app is now, Charlie, you can message me anytime, day or night. I get back to people within 24 hours, except one time where I messed up and didn't see someone's message. You know who you are. I'm so sorry. But if I don't respond in 24 hours, just say hello, get my attention, because every once in a while I miss one. But it's cool. It's fun. We can like communicate one-on-one. You don't have to put your business down on the streets and social media. And you can ask whatever question you'd like. So hope to see you there. Okay, special also on methotrexate, 2.5 milligrams, 6 tablets once a week, started a while ago. Oh, that's okay, Deborah. Thank you for doing these meetings. Oh, thank you, Susan. Would love to do a private meeting. Okay, wonderful, Susan. Go to regenesisrx.com and you can book a meeting with me there. Or if you are an app subscriber, Susan, make sure you book within the app. You get like $50 off the one-on-one meetings with me. So check it out in the app. It'll be under, I think it's under content, and then just go to book a one-on-one session with me. Do it through there. It's going to be a lot cheaper. Okay. Oh, yay. So glad you joined the app, Kathy. Can't wait to see you there. Okay. Oh my goodness. Well, I spelled it wrong anyway. Hold on. It's www.regenesisrx.com. Okay, I spelled it right that time. So hope, oh no, that's a direct message. How do I do it to everyone? Everyone. www.regenesisrx.com. Okay, sorry, Minnie. I was direct messaging you. I meant to do it to everyone. Okay, we should be good. Okay, I take rifaximin due to SIBO. Oh, yeah. That is considered a strong antibiotic. No, Marcia. The nice thing about rifaximin is that it tends to, it's not one of these broad spectrum ones that tends to lead to C. diff. No. You should be fine. I'm sure it's possible. It's possible with anything, but rifaximin kind of works in a different way. So you should be good. But still, make sure you're washing your hands. And it's more the broad spectrum antibiotics. We'll see it with like clindamycin is a big one, right? Or I think doxycycline is another one that's more prone. So you should be fine, Marcia. Sending good vibes your way. I have learned more in here this hour than my entire life. Oh, Kathy, I just had a colonoscopy this past week and was told to take Miralax daily, and that my lifelong constipation was due to my multiple sclerosis diagnosis. That was only 16 years ago. Ugh. Kathy, I am so glad that you learned so much. You're going to bring tears to my eyes. Oh, you guys are incredible. This is why I love doing these. Okay, well, that's it. I think that's the end of the messages. So I'm going to go ahead and end this meeting. If that's, oh, wait, there's one more. Great presentation, which is fully related to my health issues. I really love your videos and look forward to more. Oh, thank you so much, Ed. I appreciate you. And thank you, Marcia. You guys are so amazing. I absolutely love all of you. Let me go ahead and stop this video.